How severe iron-deficiency anemia affects CRVO. Iron-deficiency anemia can, paradoxically, increase the risk of thrombosis, despite being considered a hypocoagulable state, in some aspects. The body often responds to iron deficiency with reactive thrombocytosis, an elevation in platelet count, that heightens the risk of clot formation. Additionally, anemia leads to reduced hematocrit and blood viscosity. In severe cases, this can result in turbulent blood flow and endothelial injury, both of which further predispose the vascular system, including the retinal veins, to thrombus formation. Chronic anemia also impairs endothelial function, compromising vascular integrity and making the central retinal vein more vulnerable to occlusion. The retina is highly dependent on a continuous and adequate oxygen supply. Severe anemia reduces the blood's oxygen carrying capacity, leading to retinal ischemia and hypoxia. Upregulation of vascular endothelial growth factor, VEGF, which worsens macular edema and promotes abnormal new vessel formation, neovascularization, associated with CRVO. Severe, chronic anemia may also cause systemic hypotension, reducing perfusion pressure throughout the body, including the retina. This can slow retinal venous outflow and create venous stasis, another risk factor for retinal vein occlusion. While generally health-promoting, a plant-based diet can sometimes lead to iron deficiency, if not properly managed. This is due to lack of heme iron, which is primarily found in animal products, and is more readily absorbed. Presence of phytates and polyphenols in plant foods, which inhibit iron absorption. When combined with menorrhagia, heavy menstrual bleeding, the risk of developing severe iron deficiency anemia increases significantly. Anemia secondary to a plant-based diet and menorrhagia may contribute to or exacerbate CRVO through increased thrombotic risk via reactive thrombocytosis and endothelial dysfunction. Reduced oxygen delivery to the retina, intensifying ischemic damage. Systemic hypotension, leading to venous stasis, and further risk of retinal vein occlusion. In young women, presenting with CRVO, but lacking traditional risk factors, such as hypertension or diabetes, clinicians should strongly consider iron deficiency anemia as a potential contributing factor, particularly if the patient follows a plant-based diet or reports heavy menstrual bleeding. Management should include correction of anemia with iron supplementation, oral or 4 as needed. Treatment of underlying causes, such as hormonal therapy or other gynecologic interventions for menorrhagia. Ophthalmologic treatment for CRVO, which may include anti-VEGF injections to manage macular edema and neovascularization. Laser therapy in select cases. AC STIM, specific frequency alternating current stimulation therapy, to promote vasodilation and enhance retinal microcirculation. For a personalized medical evaluation, please contact our team at info@restorevisionherbs.com. We provide tailored treatment plans that address both the ocular and systemic aspects of your condition.